Yes, thank you. Good morning for everyone. Um, can you hear me? Yes.
Yes, yes.
Voice
Okay,
is
Yes.
audible.
thank you. Okay. Okay, my name is Natalia Costa. I'm from Colombia, and I've been using homeopathic since I was a little kid. Um, but what I value the most with this kind of
Oh, the
medicine
internet is very unstable.
is that I'm sure that my doctor is um, value or evaluating all my system. Uh, a few years ago, I used to have headaches, constant headaches, and I use first my healthcare system. Here in Colombia, the system is based on Western medicine. So now I went there, and he checked my blood pressure and said, "Okay, take painkillers, and we will see what happened with your headaches." So the headaches continue. So I went to my homeopathic doctor. And the evaluating was quite different. He started asking me questions related with my feelings, my life, how was my life at that moment, and it was quite different. And also he asked me about my if my pain was where was located in my head and when was worse. So I really understand that day that he was treating all my system, not the part of my body that was in her. So of course the pain dismissed, disappeared, and I was feeling quite well since that day. So the things that I want to to say is that uh, you feel when you were with a doctor that use homeopathy, you really feel and understand that he's looking at all of you, your emotions, your life, and also you, of course, your body. But it's not only the part of your body that is in pain. So I really value that. I all for a long time I use homeopathy, but I really all the time I feel like a human being, not just like a part of a body. So I think that that's great in my experience. That's what I wanna say today. My mother used homeopathy, my brother used homeopathy, and today my two kids also use this kind of treatments, and we see a difference with the Western medicine that is what we use here in Colombia, because most of the time. So that's it. I think that that's my experience. Is great. I really value this kind of medicine, and I don't know. That's it. That's my example.
Oh, Natalia, we are very encouraging with your testimony. Thank you very much
Okay.
for sharing with us this beautiful experience.
Appreciate.
And say hello to all your family. Greetings. Our next participant is Adriana. Thank you. Thank you. Thanks a lot. Uh, Adriana is going to share us their experience as a patient. Adriana, you can go on.
Please, please unmute Adriana. Second, second is please unmute Adriana.
Adriana is hearing us?
Yeah, I'm here.
Yes.
Thank you. So, hey everybody. I hope all of you are very well. I'm Adriana. Thanks very much for this time and space. I'm from Bogota, Colombia, and actually I have an excellent experience using homeopathy. I think that it all started 6 years ago, approximately. I remember that by the time I was founding my own company, and of course it was amazing. But however, creating a new business implies a lot of different responsibilities, and when you're doing something for the first time, maybe that start is the hardest one. Pardon. So besides the start of my company, I was dealing also with a lot of different things. For example, my father's health was not the best, and it was very difficult for me to accept that fact. Even more, when he always had an excellent health. So, but you know, things change, and this was not an exception. So, in addition, by the time my pet got sick, and also it was very hard, and it was because we did a trip to a farm, and I didn't know that in that place they used to hide food with poison, like as a measure to control pests. But in that case, the victim was my pet. She was just exploring the farm, and she found out that piece of meat, and she ate it. So that day was horrible, but fortunately we could arrive in time to Bogota again, and she received a proper medical treatment and could overcome that awful situation. But well, I'm telling all of these things to you to contextualize what was happening when I started using homeopathy, because all these situations made me feel so stressed. And in addition, when I was a teenager, I suffered some episodes of gastritis, and I just felt that gastritis was coming again to me, and I didn't want it because it was so painful. Therefore, I decided to find an alternative solution, and somebody recommended me to try homeopathy. But at the time, I didn't know very much about it. However, I did a research, and I decided to start with it. I found out very interesting that homeopathy doesn't care just for your body symptoms. It also cares about how you are feeling. I could see that they look at you as a unity in regards with your body, mind, feelings. Everything is connected. So I could realize that homeopathy looks forward to cure not just the symptoms, but also what are originated those symptoms. Therefore, the first treatment that I had was for that gastritis, and it worked perfectly for me. And also, at the same time, I realized that I was feeling calmer. And in general, it was like recovering that balance and again reaching that point where you feel good physically, but also you feel good with all your being. So after this, I started another treatment for my periods because they were so painful, and every month I had to take some painkillers, and even in some cases they didn't work at all. So the first and the second day of my period were so annoying, and in some cases I had to stop everything because I couldn't focus on my work on my studies or on whatever I was doing because of the belly cramps. For this reason, I started using also homeopathy also for this situation, and happily I could see their positive effects on me very soon. I think that just in a couple of months, the pain started to reduce a lot. And also I began to have a regular cycle. Just for all these reasons, I was really amazed about what homeopathy can do. And I started recommending it to my family, friends. Currently, I think that almost all my relatives are also using homeopathy treatments. Even my pet is also taking homeopathic treatment, because that awful experience that previously I talked about left her liver suffering a bit. But thankfully, it also worked perfectly for her, those treatments. Since then, I have changed my habits, and I go regularly with my doctor, who of course is specialized in this branch of medicine. And also when I specifically feel that something inside me is not working properly, my first option is always homeopathy. I also would like to share with you that I like very much this focus of the medicine, because I feel that it is very human. I think that this is very connected, as Natalia was saying before, because although this may sound like a bit redundant or maybe obvious, it is supposed that we are dealing with humans. But in some cases, I feel that people can fall into the trap of only medicate, forgetting maybe unconsciously that they have in front of them a human being with feelings, somebody that can be afraid of what is happening with him or with her, someone that can be facing maybe uncertainty about their health and what is going on to happen in the future. So even though nobody knows what's going to happen next, it feels a great relief to know that you have the support of a health professional that cares for your physical and emotional integrity. So maybe another aspect that I would like to highlight, it is that when I took those painkillers for my belly cramps, they caused me some side effects, because I felt that they affected also my gastritis. So for some reason, my stomach didn't like very much those pills. But in contrast, since I'm using homeopathy, it feels like it works for the belly cramps, but also it works like for the general stomach. And also it's very important to mention that it feels like it works to contribute to a general well-being. So, well, finally, I would like to take this opportunity to thank first Life, because for giving me this opportunity to know about homeopathy. As I said before, I didn't know very much about it. It just started maybe 6 years ago. So I'm very grateful for this, to get to know all these alternative treatments that works perfectly and are very respectful with your being. So I appreciate this really very much. Secondly, I also would like to thank my treating doctor, because he always takes the time to listen to me, for also being so empathetic and for explaining me everything that I need to know. And of course, for all the medical treatments that we have done. Honestly, they have worked perfectly. And maybe last but not least, of course, I'm very grateful because I feel very secure that also my loved ones are using this branch of the medicine. So this is my testimony. I hope it is useful, and thanks so much.
So please unmute Benitez. Please unmute Benitez. Second. So we can't hear, sir. We can't hear, sir. You can unmute yourself. You can unmute yourself. Benitez, you can unmute.
Please make Dr. Benitez co-host.
Yeah, I think that he cannot unmute his microphone.
Please unmute Dr. Benitez.
Please unmute from your side, Dr. Benitez.
Oh, thank you very much. Adriana, thank you very much. We're very grateful with you. Okay, let's go. Next patient is Adriana Velandia. Are you ready, Adriana? Adriana? Belandia? Oh, in the meantime, I watched Juliana Bedoya because I asked her to get in before. Juliana, are you ready?
Who is that? How will we
Juliana
identify
is
the person?
Juliana
Can you make raise hand? Can you raise your hand?
Juliana Bedoya.
Can you raise your hand?
She
Who is
was.
the person Dr. Benitez
I
is
was
talking?
watching her.
Is
Juliana,
there?
excuse me. Yes, she was here. Juliana or Adriana.
Is she's there?
No, she's not
Tatiana.
here.
Tatiana Benitez? Is it
She's
Tatiana
here.
Benitez?
No, Ana Maria Lora, could you please start?
Okay.
Yes, Ana Maria Lora is the next.
You can unmute from your side. You can unmute from your side now. Okay.
Hi, good morning to everybody. Can you listen to me?
Yes.
Yes, very well.
Okay, thank you. Thank you, Dr. Germán Benítez. Well, my name is Ana Maria. I am from Colombia. I'm from Cali, but I live in Bogota many years ago. I am a mom of 2 children, and I'm going to share with you my experience with the homeopathy with my children as mom. When my daughter is now 12 years old, and when she was 3 years old, so it was nine years ago, she had her first asthma crisis. It was the first time we had this experience with her. We didn't know what it was, what to do, anything. And this first asthma crisis was so hard that, well, we had to go to the hospital, and after many hours trying to help her, she ended in the ICU. I think it's in English is the same, right? The UCI,
Yes.
the ICU. It was very shocking for us because it was the first time we had this experience, and the first time was so hard. So since that moment, she began to have crises recurrently. We had to take her to the hospital all the time. Each time she had a cold, like a small cold, always she all the time, like, it ended with a crisis, and many of these times we had to hospitalize her. At the same time, she was experiencing a very strong allergy in her skin to mosquito bites, and we used to go to some places in Colombia where there are a lot of mosquitoes, and it was very hard. Every time she was bitten or even touched, the place became very inflamed, and when sometimes, for example, in her hands, she even couldn't move her hands because they were so inflamed. It was very hard. It was not an allergy like like just getting red, and no, it was a very hard allergy. And so we started treating her with Doctora Clara Inés Sandoval here in Bogota. At this moment, we started treating her with homeopathy, and all these crises and the skin allergy started to be less and less recurrent. The change was not from a day to another. I know you, I think you know that, but it started to be easier to manage her at home. For example, with her husband, with her crisis, it was easier and easier at home. We didn't have to go to the hospital all the time. The medications were reduced all the time until we didn't need them anymore. The treatment, I think, took about 2 years, more or less. And I remember the last time she went to the hospital was when she was 5 years old. So it was like from 3 years to 5 years old that we had these experiences. And after that, she may have had some. Sorry. After that, she may have had some mild crisis, but treated at home. And this is the moment. She's now 12 years old, and I can say that maybe 6 years ago we like was the last time she had a crisis. She has never had a crisis again, and she didn't have to use more medications. And at the same time, the skin allergy was like at the same time treated, and it was the same. After that, like 5 or 6 years ago, I think she never had more these kind of reactions to mosquito bites. So I think this is like my experience, like the experience I wanted to share, because it was something very, very concrete. Also, we changed many things at home after we started using homeopathy as treatments. Food, we had many changes with food. We started being more conscious about emotions and all these, because as other patients have been talking about, this is not something just we treat like the body only. So it was very, very nice to understand how this medicine works. It has been very useful for us as family, as for me as mom, as person, and as family. This is the experience I wanted to share.
Thank you. Yes, Dr.
Oh, thank you very much, Ana Maria. Dr. Shaji, I would like to give to ask to Adriana Velandia to start their experience. Is she in the forum?
Yeah.
Could you unmute her?
Yeah.
Hola, buenos días a todos. Espero que estén todos muy bien al lado de sus familias. Soy Adriana Velandia, médico especialista en seguridad y salud en el trabajo. Soy mamá de 2 hijos, de Nicolás y Juan Sebastián. Tienen 9 años y 1 año y medio. Se los presento, Juan Sebastián. Nicolás está durmiendo en este momento. Y soy esposa también de un hombre maravilloso que se llama Álvaro, que también es médico, especialista en seguridad y salud en el trabajo. Hace muchos años tuve la oportunidad de tener un acercamiento con la homeopatía, estudiando y siendo un diplomado. Eso fue hace muchos años y tuve la oportunidad de conocer este maravilloso mundo. Y afortunadamente...
Adriana, ¿podrías darme un segundo para comenzar a traducir?
Claro.
No sé
Me
si
disculpo
todos...
que les hable en español, realmente mi inglés no es muy fluido.
No pasa absolutamente nada. Voy a tratar de traducir de la manera más fiel posible, aunque mi inglés tampoco es el más fluido últimamente. Si alguien me quiere apoyar, no hay ningún problema. Adriana is a colleague. She is a doctor. She's specialized in social security. And his husband is doctor too. And she's going to talk us about their experience. She was studying homeopathy by taking a course some years ago. Continúa, por favor.
Lo estudié, pero por temas laborales y situación de la vida me enfoqué en seguridad y salud en el trabajo, pero pues tuve la fortuna de conocer a la doctora Clara Sandoval, quien es la pediatra y ha sido la pediatra desde los 3 meses de mi primer hijo.
Un momentico. She studied homeopathy, but because of the work, she couldn't go again. She is a patient from Doctora Clara Sandoval. Dr. Anil, could you stop your phone? Thank you. And so, continúa, por favor. Adriana, could you, excuse me, could you help me with the translation? Adriana.
Ok. Mis 2 hijos presentaron alergia a la leche de fórmula y a algunos alimentos complementarios desde los 6 meses de edad.
Their 2 sons present allergy to milk formula since 6 months of age.
Y mi hijo mayor inició tratamiento con la homeopatía, para lo cual ha tenido muy buenos resultados. Ellos tuvieron síntomas dermatológicos y síntomas respiratorios.
Their oldest son had allergic symptoms from skin and gastrointestinal too.
Para lo cual con la homeopatía ha tenido muy buenos resultados en ellos. Mi hijo mayor tuvo un proceso de unos 5 años mientras lo estábamos tratando. Ahora tiene 9 años y es totalmente saludable.
Their oldest son has a treatment with homeopathy. He is 9 years old and he is in very good health conditions just now.
Juan Sebastián en este momento se encuentra en tratamiento. Ha mejorado muchísimo. Ya su piel ha mejorado, no ha tenido ningún tipo de enfermedad respiratoria, para lo cual estoy muy agradecida con la doctora Sandoval de todo este apoyo que ha dado a mi familia.
Johann Sebastian is good now. He has no any kind of respiratory allergy. And she is very grateful with Doctora Clara Sandoval.
Creo que la homeopatía da excelentes resultados en la pediatría y como médico lo recomiendo y lo recomiendo a todas las personas que conozca, y he enviado también muchos pacientes a la consulta de la doctora Clara porque estoy segura de que este tratamiento es muy bueno, sobre todo al inicio, desde la corta, desde el inicio de la edad de los niños. La recomiendo muchísimo.
She recommends homeopathy. She thinks homeopathy gives excellent outcomes, and she recommends to patients and friends to start homeopathy treatments since the beginning.
Muchísimas gracias. Quería comentarles, este es mi testimonio y pues espero ayudar muchísimo en todo este proceso y de fortalecer esta ciencia tan importante.
Thank you very much. This is my testimony. I hope to help in this very important process. Muchísimas gracias por tu testimonio y de verdad que estamos muy, muy agradecidos. A continuación, next we are going to start with Juliana Bedoya. She is going to share their experience with us. Juliana, could you start? Dr. Shaji, could you unmute Juliana?
Yes. Sure. Who is that? Can you raise your hand to identify you? Okay, okay, yeah. Thank you, thank you. Please unmute yourself.
Okay, now?
Now, yes.
Perfect. Okay, good morning. My name is Juliana Bedoya. I am a journalist and I've been close to the homeopathy for over 30 years. The first time I heard about homeopathy was almost 30 years ago. I was a kid with good health, nothing special, more than some tonsillitis episodes that were like very repeated, like 2 or 3 years a year, two or three times a year. And at 8, 9 years, I had undergone an appendicitis surgery. And after that, I had one of my tonsillitis episodes. At that point, my parents got worried about my health and the huge amounts of antibiotics I was taking. So they got worried and they didn't know what to do. Almost at the same time, my sister, my younger sister, had an infection by streptococcus, and she also had to take a huge amount of antibiotics. So at that point, they took the decision to find something that were more natural, like to treat all the things that could happen to us as a kids. And that's why we got the first time to an homeopath practitioner. And we went to the same homeopath for almost 15 years. He became a friend of our family, and I think that's the most important thing of all the holistic part of or process of this kind of medicine, that you don't not only find a doctor, but you find a friend. I remember having these drops for everything I had. If I had a fever, if I had a cough, if I had whatever I had these drops, 5 drops, 1 drop every hour, every 2 hours. But on the other hand, I remember my friends and my cousins and all the kids that I was surrounded by taking any kind of medications and lots of medications of different medications. And I was always like asking myself why I didn't take that, but took those drops, like these simple drops, and that made me feel better. I didn't understand well what's happening. I also remember how we always asked it. Our doctor always asked for aspects of our lives, and not only about our health. And for me, that was very valuable, because it made me feel cared, and it made me feel confident with him in a way I never found with allopath practitioners. Even when they are like in a long doctor-patient relation, I haven't felt that sensation again with that I felt always with a holistic practitioner. After going in and out from some holistic and allopathic practitioners, I always felt better with myself when I was in an holistic or homeopathic treatment. Because of that relationship that appears in the process. For me, that's, I think, the most important thing. And even that relationship became more important in terms of feeling good, even if it took more time on the treatment to get better
like from the health problem I had. When I became a mom 8 years ago, I was sure that I wanted the same relationship and homeopathic treatments for my kids. And we found Clara Inés Sandoval, that it is also a longtime friend of the family. And I found on her that kind of person that I wanted to be the doctor of my kids. I remember our first appointment with our older boy, and immediately she made that connection with him, the same connection I had with my doctor. And it was very important for me because I understood that it wasn't only that doctor but that is part of all the homeopathic and holistic process, to be connected and to make a bond with your patient in a way that makes him and the family feel confident and feel cared, not only like in the health aspect, but like in the whole human being aspect. And that was priceless for me. It was that priceless that we moved 7 years ago to Cartagena, to another city, because we are from Bogota in Colombia. We moved to Cartagena, and even in the distance, Clara Inés is our guru. Always when we have any kind of problem with our kids, we call her. She's always so there for us, and she has always took the right decisions, even in the distance, for our kids. The most important thing I find in this relation and in a long distance and a far away relationship with homeopathic medicine as a mom is that we have some options to choose, not only one option, not only give him antibiotics or give him I don't know, any kind of normal medicine, but also take the decision of giving our kids other kind of medicines and other kind of products that we are sure that are better for them. We don't put out of our their healthcare process like allopathic medicines. One reason is because in the city we live, homeopathic medicines are not that common and are not that easy to find, but also because we feel that we have options, and when we have options we feel secure and we feel safe that everything is going to be okay with our kids. And now, after 8 years of homeopathic treatments for our kids, we can say that they have very good health, and that they have a way more or less like traditional medicine, allopathic medicine than other kids of their age. And they go by and recover faster for simple illnesses, because thank God our kids have a very good health. They recover faster than other kids of their age that we know, and that have several, that like a simple problem become a chronic problem. And I think part of this fast process of recovering is from homeopathic medicines. So I'm very thankful with homeopathic, with homeopaths, with doctors that practice this kind of medicine. And I feel that more people had to find them like an option to have a good health, and more natural and more like close to the nature and the nature cycles and life. That's it. Many thanks, and hope you have a good day.
Juliana, thank you very much. We are very grateful with your testimony. And we have a little surprise. The current family is formed not for people, but by pets. And we have in Colombia one specialization in homeopathy veterinary. Doctora Marcela Muñoz is going to talk us about this wonderful branch of homeopathy medicine. Marcela, good morning.
Hi, I'm
Juliana, thank you very
here.
much.
Thank you. Thank you, Herman. Thank you for inviting me. I know this is a kind of work because we are talking about animals, but maybe if I can share a little PowerPoint presentation, I would like to show you some clinical cases in veterinary. And I don't know if I can share my screen.
Yes, yes, please.
Okay, thank you. Still looking disabled for me. In the meantime, I will present myself. I am the academic and research director of the University Luis G. Páez in Colombia. We are a 100 years university in Colombia teaching homeopathy for physicians and for veterinarians. And we have a specialization authorized by our government on the Ministry of Health and also the Ministry of Education. So this is, I think, we are in the best scenario for homeopathy in Colombia and in the world, I think, because it's been harder for homeopathy in
You are a co-host now, so you can share your screen.
Okay, thank you. Okay, let me. I need to put this. Okay. Are you looking at my screen right now?
Yes.
Yes.
Okay, but I can put this on presentation. Yes, finally. So, as I was saying, I work for the Fundación Universitaria Luis G. Páez. I am a veterinarian from the National University in Colombia, and I'm a certified veterinary homeopath and certified teacher from the IFPH, which is the International Association of Veterinary Homeopathy. Okay, this is our website at the university. This is kind of our students. You see, they are very happy because they can do a very different type of medicine. This is the smile of all the homeopaths, I think. And how veterinary homeopathy starts. Hahnemann said that these laws that he proclaimed are those of nature. They will be valid for living beings. And veterinary homeopathy it has the same birth as physician's homeopathy. And in fact, it was Hahnemann who treated animals first. And he, in 1840, made the first mention in animals in an article he titled Homeopathic Healing Art of Animals. And then we have what we call in veterinary the father of homeopathy veterinary, who was Johann Joseph Wilhelm Lux. He used mostly no-soods more than homeopathy, and Hahnemann didn't like him too much because of that. He said this wasn't homeopathy, but we consider that he was the first veterinarian in using homeopathy in history. And you know, it was in the time of Hahnemann. So we have a lot of experience in healing animals with homeopathy. Today, we have the IFPH, which is the International Association of Veterinary Homeopathy. We made a congress every year. Last Congress was in Colombia, which I'm very proud we had it. We have a veterinarian from all over the world in Colombia, sharing their experience. Now, the IFPH has 36 countries and more than, I think, 400 veterinarians all over the world. Okay, so how is the veterinary homeopathic consultation, which is the same as the humans? We make an consent inform, so we can share with the care providers about the risks, the benefits, and the alternative with homeopathy veterinary. In fact, Adriana is one of my patients. Well, no, Adriana, Luna, his pet. We make the same case taking, even if pets can't talk. We have, like Hahnemann said, and he said that. Also, animals do not have a language, that the observable changes in their exterior, in their way of acting, and in the execution of their natural and vital function serve the same as if they had. So it's a little bit difficult, but I think it's like when you do pediatrics, you know, you can rely on the owner's testimony, and also you have to be very or have a very acute observation of the animal. And we became, I think, very, very good at clinical exam. So we also do a clinical and very good paraclinical examination, so we can help us. We made the diagnosis like any other veterinarian. We repertorize, and we have the hierarchy of symptoms. We search for the characteristic symptoms. Also, animals have very particular symptoms, and actually we have one repertory for animals, which is not that good in my opinion, and we use human repertorization. That is a little bit of trouble, but we are very careful about what symptoms to take. We have actually a lot of materia medica in veterinary, you can see. I'm actually translating, I am sorry, let me go back. I actually translating, I speak French also, and I'm actually translating the Jacques Milliman Matière médicale homéopathie vétérinaire, because it's a very, very good materia medica, with a lot of clinical cases to support the remedies. And we can reach with the final goal of consultation in homeopathy, the homeopathic remedy. And we separate also, we have acute cases of chronic cases, which is more chronic in some cases in veterinary. We have to be very careful about posology. I think it's the same in humans, but in animals, we have to look at the vital energy to choose the posology. If it is an organic problem or a behavioral problem, or which species is because I think maybe cats are more sensitive to homeopathy than dogs, for example. And also with horses, horses are very, very, very sensitive to homeopathy and react very well to homeopathy. So we have to look also that. And we do the follow-up case also, if we give dosimelimum, if we have aggravation, and what kind of aggravation, if we have new and old symptoms, or nothing sometimes. Oh, it's not easy. And based on those factors, we choose a second prescription, okay? And I'm going to show, I know I have a little time, so I'm going to show you some clinical cases. This is a papillomatosis cases I see a few years ago. This is Mia, 6 months, is a mixed border collie. This is Mia, she is very beautiful. and she has her mouth full of papillomas on her gums, on the heart and the soft palate. It was smelling so bad, she can hardly eat. He has 2 months of evolution with all kinds of medicines, allopathic and also complex homeopathy, which is really expensive and with no result. So this is the picture of Mia. You can see all the papillomas all over her mouth. He has a big one here on the soft palate. It was awful. And it was maybe an obvious choice, the Tuja. Yes, but we did a representarization. It was a Tuja. I give her a Tuja 30 pH, 3 drops twice a day for 30 days, but I make a follow-up 20 days after we start the treatment. And this is what the 24th November of 2015, all the papillomas were gone. You can see even the one in the soft palate is gone. I asked the owner what happened. They fall, they eat, what happened? And she said, I have no idea where they go. But this was, I think this is an easy case in homeopathy, not so easy for allopathy. This is Melissa. Melissa was okay. The owner came and said to me, listen, yesterday he was okay, and today he's like this, okay? She was paralyzed. I have many cases like this in my consultation. You see, she likes to bite. This is not because of pain. And this is Melissa. She can walk, but she is not completely paralyzed. He is a paresia. She can move a little bit. I can show you all the repertorization and everything because she has some changes in her medication. And this is another. Okay. The doctor, this is an orthopedic doctor. He says to the owner, we have to make surgery, and the person doesn't have the money because it's so expensive. So she came to my consultation and say, let's do homeopathy and see wherever we can go. And I give her arnica with some different posology and different, I will show you next, and different scale and dynamization. And this is Melissa 2.5 weeks after eyelids. Wait, I couldn't. Hello. Okay, and this is another follow-up, maybe a month after. We think that he was this discal hernia in the lumbar zone of the spine. but we don't have a diagnosis. And I love arnica. This is about, you know, I have radar, and radar allows you to make a therapeutic evaluation. So I start with arnica 200 CH, and it was okay, but not that okay. And then arnica didn't work, and then I put it in 1000. And she stayed for the 1000. And this is a really interesting case, because in this case, I think arnica was the constitutional remedy, because I treat Melissa for many years, and it was always arnica. So I never saw an animal. I think we assume that arnica is an acute remedy, but in this case, it was not. It's a constitutional remedy. This is Figaro. He's a cat, a very angry, aggressive, biting cat with polydipsia, polyuria, polyphagia, with a sudden weight loss. We make him para clinical exam, and he was 4 process in glucose in the urine, and the fructosamine was really high. So he needs insulin. This is a diabetic cat, but he was so aggressive. There was no way to put to make injection of insulin in this cat. And the owner came to my consultation and said, I don't know what to do, and I'm going to make a travel. So there is no way this cat can get insulin. So we made all the consultation in homeopathy well done, and he was finally a sulfur. And this is the first exam, and this is we put it in sulfur 1 LM. I use a lot of LM in cats because they are very sensitive, and they have the tendency to make aggravation really, really easy. So I use LM almost in all cats. And we put it in 1 LM, 5 drops twice a day. And this was really easy. You know, this is the fructosamine really descent. It was in a level that you can support for a diabetic cat. And which is really good in this case is that the cat become really sweet, and he allowed the exam after, and he changed completely her behavior. So it was a good case. With this cat, which it was an old cat, I have to use every time that any symptom returns, what I did was to raise the potency. So we arrived to 18 LM each, and finally, when he was a 13-year cat, he died finally. And this is Suleika. I love this case very much, because this is Suleika. When he was found in the street, he was very sad with a lot of problems in her health. And he was rescued by a foundation. And they bring it to me, and they allow me to do all the homeopathy I want. So we start with sepia in many dilution. The skin became terrible, which was good for me. And the first thing he got with sepia was this kind of papillomas or warts, and they disappeared also without doing anything. And we gave her pulsatilla then, and then sulfur, and then he has a parasite of the blood, which is Ehrlichia, and we gave him arsenicum. And this is 1 year after Suleika. You can see the change. She was a princess. She was such a beautiful dog behind this really abandoned dog. I like this case a little bit because this owner allowed me to do and went to the aggravation with me and everything, and she never resigned. So that was really good. And this is an acute diarrhea managed by WhatsApp, you know, by phone. I wasn't in the city. This is Aragon, a dog de Bordeaux, 1 year old. And I have seen it because he has a otitis and some skin issues, and his partner, another dog, has died. And everything was okay with phosphorus 200 CH. But the owner traveled for 3 weeks, and he stays at the nursery, and they found it in this condition. You know, he's really, really emaciated, and with this kind of diarrhea. I'm sorry for the pictures. And I teach my owners to see if they are really dehydrated or not, and he was not that dehydrated, so he stand for treatment in the house. There were no need to go to the clinic. So I repertorized like an acute, just two major symptoms, and it was a phosphorus also. And so he gave it 3 drops every 2 hours. And the next day it was the stool of this dog. So I want to honor my master. My master is Dr. Jacques Milliman, who is a French guy. He's absolutely fantastic. And this is everything. I don't know, you have too many time, Herman. Thank you for the opportunity to talk about veterinary homeopathy.
Oh, thank you very much, Marcela. Zuleika is a princess and you're a queen. Thank you very much.
Thank you,
Dr. Shaji, that's our...
Thank you, Dr. Benitez.
Okay, thank you.